Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She is the administrator of the Champaign-Urbana Public Health District. Julie, am I reading this right that more than 20% of Champaign County's adults have been vaccinated?
That is correct. Actually, let's see, as of this morning, 23.4% of our county, which is 40,426 of those eligible, have been vaccinated. 55% have received the first dose, and that's 94,579 out of 172,000 and some change. So we're happy with it, how it's moving along, but we would like more vaccine. One of the things we're most excited about is that 72.91% of those over 65 have been vaccinated. We want to see that way closer to 100% though, because those are the ones who are most vulnerable and most likely to be hospitalized or die or have serious complications.
So are the people that are unvaccinated in that age group, is it a variety of reasons? They may not have access to a ride, or they may fear the vaccine, or what are some of the other reasons that you've heard that people who are eligible are not getting the vaccine?
Well, so we have heard all kinds of things. So recently I put my name and email and phone number out there so that people could either call me if they were a senior, or somebody that cared about a senior could email me their information so that we could reach out to them. Sometimes they would like some questions answered. Sometimes they just did not realize that they were eligible yet. Some don't consume local media, so they might not know about it. Others, some of the ways you get appointments is to go online, sign up for something through online, and people don't have access to the internet, or they don't have ability to do that. There's just many reasons. We don't know the percentage of those who just simply don't want to take it. We think that most people probably just want some questions answered and, what might be best for them. So we've tried to make it as easy as possible. For those who have, who are homebound, Carl is working right now to get those individuals vaccinated. And then public health is out in the senior apartment complexes getting everyone vaccinated there who wants to be. So, we're trying to figure out what it is, and we're trying to make it as accessible as possible.
For my friends who don't have pre-existing conditions and they're in their 40s, so they're in that spot of just, we can't get vaccinated yet. They're coming soon, correct? That's the next level of people.
Yep. So the next level of people will actually it's going to be the same, but it's going to expand to a bunch of different jobs. So if they happen to work in media or, possibly libraries, all kinds of different things, it's not specified yet exactly who will be in there. Restaurant workers for sure will be in there, but it's going to be a lot more people. But until we get to about May, once we get to May, everyone, it's, what the Biden administration has said is that by May, we can open it up to all adults, which will be wonderful. And, we will like to do that. But meanwhile, we have some really hard work to make sure that we get everyone who's most at risk vaccinated first. So if you know of anyone, please give me a call or email me, and let's make sure that we get everyone vaccinated before we get to that time.
One of the secrets to getting this done more quickly is that we have a third vaccine, but I understand that Johnson & Johnson is slow on the rollout. Do we have any of that in our community?
Well, so we haven't received any at CUPHD. CUPHD gets the vaccine, and then we allocate it to Carl and Christy and OSF and all of our community partners who are doing vaccination with us. But this weekend, Walgreens from the federal level did get doses. They brought them down. They started with 500 doses. They upped it to 1,000 and then later to 1,200. So that was pretty exciting. They were able to, and their clinic was amazing. It was over at Douglas Center. Community activists helped us to get people, bring them in, the people that were eligible. So that worked, really well. And 1,200 people got vaccinated this weekend with the one and done vaccine. So they're done. In 2 weeks, they will be considered fully vaccinated.
I saw you post a genius hack that when you get your first vaccine, make sure you take a picture of your card so that there is no issue for the second one. The person in front of me in line lost her card, and that was a whole issue. So what a great idea that you have for that. As people show up at the clinics right now, Are the lines trickling down? Are the numbers slowing down because people who have wanted in and who are eligible have gotten in and gotten it?
No. So what we're doing right now is, everything we do is by appointment. So that makes the lines a lot less to begin with, because we know how long it takes to do a vaccine. So we can have that many vaccinators plus a number coming through, and we can make sure that there's not a lot of waiting. Mostly what is being done right now in our county for at least the next 2 weeks, most of them are second dose vaccines.
I have a coworker who's headed to South Padre. It's spring break, and other friends headed to South Beach in Miami. Are we going to see another spike? I know you shake your head. I fed you that, but are we going to see a spike in 2 to 3 weeks?
Probably we will, yes. I hope that we don't here locally. We have a high number of vaccinated, but again, if you are traveling and you're not vaccinated, you are at risk. And, we have all the variants going around, and we do not want to keep giving those an opportunity to turn into something that is much scarier than it is now. Right now, the variants that we know about, the vaccine still works to protect us from those. But, if we keep messing around with it's just like a Russian roulette. We're going to have a case that we're going to get a variant one day that we'll be able to blow past the vaccine. So right now we need to be doubling down on getting people vaccinated, and people who are not vaccinated, keeping themselves and those around them safe.
Let's talk about numbers now. In terms of hospitalizations and recoveries and current cases, where are we with those numbers?
Well, right now we are at 211 people that are positive and in isolation, 347 in quarantine, and we have 8 people who are currently hospitalized from Champaign County. So that is much lower than it's been, and we would love, love, love to keep those numbers low. Even lower would be great.
I may have a visit with my sister for the first time in over a year on Friday. We're both double vaccinated. Is that what the CDC is saying is okay? Small groups who have isolated can get together inside?
Yeah, absolutely, without masks. Once you're vaccinated, you're protected. The idea behind wearing a mask with other people who aren't vaccinated is just to make sure that we don't yet know if you could maybe get the virus, not get sick, but still spread it. So that's the idea. But yes, I can say that, once you're vaccinated and you're around other vaccinated people, it is wonderful, because it's, in small groups, it's just like being back to normal. So.
I don't want to dampen the good mood, but I just have to ask and circle back to the variant again. Parts of Europe are shutting down because it is so contagious. Is it possible that we could have this variant really spread around in our community and shut things down again? Could we be looking at another shutdown in the future?
Boy, I certainly hope not. The thing is, we have a lot higher vaccination rate than Europe right now. And I hope that we can just keep getting the vaccine in people to limit the transmission and keep the variants, in check. But we know we have a lot of the B117 variant in our community. So, we know that's more contagious. We're going to see it when you start seeing, if you see it get into a school, it's going to really go through a school, sports teams, anything like that. You're going to really see it go through there fast. So if people are not doing the things that they need to do to, the masking and the distancing, and a variant gets in there, it's going to just take off.
I mentioned that I am double vaccinated now. However, I have my child under 16 years old is not vaccinated. They're working on trials. Does that mean that he could get it but be okay, that I could bring it home to him and he could get sick? I mean, what does that mean for those that we live with that can't get the vaccine?
Well, the thing is, we don't know yet. I mean, we don't know that the reason why you wear the mask is because you could have the virus, and it could be in your, nasal pharyngeal area, and you could potentially spread that to somebody. We don't actually know if that's happening, and there are a lot of studies underway to see if that is. But in the meantime, we kind of have to act like it can be. So, just the idea would be to keep your distance from people who, especially those who are really vulnerable to it. So someone who may be more at risk. but chances are you have been around your child this whole time, and you know, it's really hard to wear a mask inside of a family unit.
Last question before I let you go. A lot of us look up to you for determining how safe we are and what are the next steps. And you set the tone for what I feel comfortable doing. I'm not ready to go into a restaurant, but what have you done differently since you got your second vaccination that has loosened the rules a little bit?
Well, it's meeting inside with people that I haven't seen for a while that are also vaccinated, including my family, which has been wonderful. And I did go to a restaurant this weekend. I did sit outside, but only because it was nice out. I was with vaccinated people. I sat outside. It was nice. There were heaters out there, and I enjoyed that. I do like eating outside. I would go into a restaurant now that I'm vaccinated. I would fly now that I'm vaccinated. So there are things that I would do that I absolutely would not have done before. Will I go on a cruise? No, but, but that's for a bunch of reasons. But I am, you know, my big concern was that I was going to have it, not know it, and transmit it to somebody that would have a negative outcome. So one of the things I am very much looking forward to is that my mentor, who is at Clark Lindsay, I have not been able to go see her for a very, very, very long time. So I do get to go there starting this week. I will get to go in and meet with her. So I am looking forward to that as well.
I always appreciate your outlook on this. And of course, as people want to know when can I get vaccinated, they should keep checking with the CUPHD website and Walgreens websites as well, correct?
Mm-hmm. Yes. So today, I know early on, and the thing is, people want the vaccine, which I'm happy about, but they want the vaccine so bad that the appointments get taken up quickly. So we're trying to make accommodations to slow it down in certain ways. Like, for example, this weekend with the clinic, to give people a chance and to give our community partners a chance to get their clients and people they work with in. But, you know, this morning, there were appointments opened up at Carl and Christie and OSF, and they were all gone within 50 minutes. So, you know, I'm very happy that people are interested in this. Keep checking Walgreens site. We understand that we may be getting some more Johnson & Johnson vaccine back in the community at some point, and we may have another clinic for that. I hope we do. So, you know, I think Walmart will come on board at some point. Other pharmacies will come on at some point. So, you know, there will be more and more vaccine getting out there, but I don't look for that to happen, really pick up until the end of the month.
Well, you mentioned our community partners. It's a perfect time to thank one of our biggest supporters, and that's Urbana Mayor Diane Marlin. Thank you so much for letting us continue to do this until we're out of questions, and this is a thing in the past. Jason Liggett, of course, UPTV, you're our biggest partner, and if only we could air what we talk about off the air. But thank you for that.
And we'd both have jobs.
We would both, and we would be shunned in the community. But Julie Pryde, thank you so much for everything you do. I'm not ready to sit in a restaurant, but one day I owe you a meal. CUPHD and all of your partners, thank you so much, and stay safe.